Okay, so good morning. I'm up recording part 4. One of the things I want you to take notice of is that I'm looking better and better every day. Still struggling and fighting with the disease, dealing with CVS, and treating it with Gerson Therapy. This is part 4. I left off talking about last time how the disease began to have a cycle, monthly cycle. This is 2009, and I decided at that point my first line of resort would be to change my diet. One of the first things I cut was alcohol. I used to like to drink, so I had to cut alcohol. I didn't really cut alcohol at that point. I cut fried food first. And then it still continued to come monthly. It would get less intense, and it would be less aggressive, and it would last a shorter time period, but it was still coming every month. And so I thought maybe I need to take more things out of my diet. So I remember taking dairy out of my diet, cheese and milk and things like that for a couple of months. And it eased up, but it still continued to come every month. Less aggressively, less intensely, in shorter time periods, and less often. So I was saying, okay, this is what it is. I'm allergic to certain foods, and they're causing this reaction. So I have to cut more things from my diet. So I believe I eventually cut meat out completely and was just kind of on a vegan diet. And by now it's 2011, I'm going to say. I'm still going through the same thing on a monthly basis, and I'm doing a lot of research now on my own, trying to find out what it could be, what could it possibly be. And so at this point, the doctors are still not giving me any answers. I'm telling them my symptoms, but they're not seeing them, they're not noticing them, and it's just every time I go to the doctor, I just talk to them about it, and nothing is happening. They don't see anything. They do my labs, they're running my labs, and they're just saying, well, your labs are coming back normal. And I'm like, well, this definitely isn't normal. And they're asking me, am I sure that I'm going through this? Just like it's not in belief of what I'm experiencing. So I'm still yet stuck trying to figure it out on my own. In 2011, attacks started to get a little bit worse, and I was laying down and having to be stuck in bed a lot more often. But I remember my brother coming around a lot this year. My brother, I remember suffering with the symptoms of the illness for a long time, a lot longer than me. His was advanced stages a lot earlier than mine were, although once mine did reach advanced stages, they progressed a lot further than his had ever had. But when he came around, he used to be in the bathroom all of the time. And I didn't understand it because my symptoms hadn't progressed to that point yet. And so I would just have the attacks, but he wouldn't have the attacks every time, but he would have daily symptoms that he had to deal with. And so I would say, boy, you stay in that bathroom smoking weed, you a dope fiend. You're a dope fiend. And he was like, I'm not a dope fiend. I'm in pain, and this helps my pain. And I remember him telling me stories of how desperate he was to relieve himself of what was inside of him. That as a man, some of the tactics that he had to try, he had to be desperate. And he would tell me that he would sit in that bathroom for hours and do things to try to relieve himself. And sometimes it wouldn't relieve, and what was relieved wasn't worth the stress, but it relieved the pain. And so he smoked a lot to, I guess, make himself feel some relief as he had to struggle to pass whatever he needed to pass to get through the symptoms he was having. And so I was still thinking, boy, the weed is definitely not helping you. But whatever. So one day I had my attack, and I was with some friends, and they were smoking weed. I had ate a hoagie sandwich. This is in Oakland. I had the best hoagie place supposedly in Oakland. I was eating these things every day. And I had kind of went back and broke my diet. Things was feeling better. It's just like everybody else. When you start feeling better, you go back to the things that you used to do. So I was eating a hoagie sandwich one day, riding with my friends, and they had a blunt, and I got sick. And it was coming on, and I said, I'm going to hit this blunt. And I hit the blunt. And I remember going to my aunt's house and sitting there sick and everybody eating their hoagies, and I'm trying to regain myself, but feeling better and better and better, and thinking, oh my God, did the weed make me feel better? And that was the start of me using marijuana to relieve the symptoms of the cyclical vomiting syndrome that I was experiencing very frequently by this time, 2011. And if you know, marijuana is a drug, a street drug for sure. So it, of course, contains a lot of toxins, more toxins. So although, yes, it's giving me temporary relief, it's loading my body with toxins, just as if I was to take the drugs from the doctor. They were giving me a bunch of drugs. I tried everything. Dicyclamine. I got so many different drugs in the back here. You wouldn't even understand what some of those things are. But they had me trying everything. Compazine, suppositories, inserts rectally, everything. And I tell you, none of it worked. None of it even soothed me like the marijuana did. And so I began using marijuana to treat my symptoms in 2011. But as you know, marijuana is toxic. Like the Vicodin I took some time for pain was toxic. And so here I am filling my body back again further with toxics unbeknownstly. The video's ending. Part 5 will be coming.